spicy, informative. I'm Dr. Miriam Smith, the host for Empowering New Nurses. And tonight, I just want to remind, yes, remind my new nurses of the importance of breastfeeding. As a reminder, I know you will encounter patients who are who will be questioning you on the breastfeeding. Why? Some of them might be having a little difficulty. Some might choose mm, not to feed, and so some of them might just need a little encouragement. However, we know we're not going to be forcing anyone, but we'll of course give them information so they can make informed decision on why they would want to breastfeed or why they would hasten to embrace that practice. And so at this time, I just want to let you know that I did do a research on the 444. I definitely would like you to go to my YouTube and be able to look at that and subscribe. The four, and the other four. And so at this time, I'll tell you that that's a guide to help with the safe storage of milk. 4 hours. Everything is clean, storing at room temperature, under good condition. Then you're going to be storing in the fridge for another 4 hours. And lastly, you'll store in the refrigerator for 4 to 6 months. So you have hours, then you have 4 days, then you have 4 months. That's what it's all about. So on a whole, it's just so individuals might discuss that it might be a little longer. However, to be safe, you want to make sure it's cool and you're within the right temperature range. So especially for moms, young moms, new moms, and caregivers, these are important guidelines that you want to stick by to ensure optimum health for your babies as they're being breastfed. And as I said earlier on, that breastfeeding is important, it's advantageous for both mom and for babies. And you know some of the benefits, for example, the breast milk helps the baby's immune system. It boosts the baby's immune system. It helps with bonding with mom and baby. Of course, it's the best. It's at the right temperature and it helps baby grow better. In a nutshell, it's golden for the baby. However, we do respect moms who have chosen not to, who are chosen another path, all right, for feeding. And just remember that uh, breast milk and formula, they're different. It's an alternative to breast milk, the formulas. And of course, just remember that no one will force anyone. But just when you think of the benefits, yes, it's more economical. When you think of some of the things that are involved in the whole breastfeeding process, the economy, the environment, it's just natural. You clean and you care for your baby. While you'll have to think of going to the supermarket, you're driving, you use up extra gas, you get in bottles, it can be such that it's more work. So we encourage the proper way of breastfeed, proper way of also obtaining and storing the milk for optimum health of your baby. So I would encourage you to share with some of your doulas, some of your nurse consultants, your nurse counselor, lactation counselors, and all of that information. And of course, listen and make I would say informed decisions. Because, for example, the nurse might be telling you or the patients that breastfeeding is so important, and the the advantages of breastfeeding, the benefits of breastfeeding, while a young mom might be listening to a friend and choose not to because of different reasons. But when they're really educated, so it's an ongoing process. You keep educating yourself, the nurse, the doulas, the caregivers, different ones in different capacities, help to ensure that moms receive adequate care and support in different ways to ensure that the baby gets the right feed, the right temperature, not being overfed, and just be proper care, adequate care for the baby. And as I said before, what this does, it will help baby to grow better. As baby grows better, it has been shown, studies, research have shown that babies who are breastfed, they tend to do much better academically and smarter, I would say. So there's research on that. So there's a belief, and of course, you want your child to do their very best and to be able to come to learn and give back to society and contribute positively to society. So these are some of the reasons why it's so important for you to breastfeed or encourage breastfeeding. In addition to all of that, I must let you know my book is on the market. It's on Amazon. It is Nurse, the Guide to Empower New Nurses in the Delivery of High Quality Care to All Patients. And there's a segment in the book that talks about breastfeeding. So you might, I'm not going to say you might, I'm encourage you to get a copy for yourself or a friend or a junior nurse or a nurse who have just started or a nurse who is transitioning from one area of nursing to another. Because of course, when you go to another area or being is a transition you're making, and some areas are definitely new for you, so you have to make some certain different adaptation, and some of those tidbits, those pearls, I would say those gems are in that book that can help you in your process of transitioning and, of course, transformation, and ensuring that your patients, from whatever culture they come, they will be able to receive adequate care, high quality, culturally congruent care. So have a great evening. I encourage you to subscribe to my channel. I encourage you to go on podcast, and you will see it says Empower New Nurses by Dr. Miriam Amanda Smith. So I look forward to seeing you. I look forward to hearing from you. And of course, bring some of your ideas, bring some of your creativity, because this will help us all learn and practice together to the highest. Thank you. Have a great evening, a great week, and of course, happy Labor Day. Thank you.